All right.
Okay. Hi, everyone. Welcome to our monthly live webinar on IIH. Every month, our purpose is to increase awareness, promote advocacy, and basically, because September is IIH Awareness Month, we wanted to go ahead and just host a chat session because we have our website, ihhub.com, where a lot of questions are filtered. And we wanted to kind of just get, some people's opinions, journeys, advice, any inspirational or motivational, like words of encouragement. And we are hosting today Dr. Pierre Gobin. He is a neurointerventionalist at Cornell. He is also the CEO of Serenity Medical. And he is here to attend if anyone has any just basic medical questions. But we are also hosting Miss Ashley Carter from Greensboro. Thank you for coming today. We are hosting you because we love your following. We love that you're a fashionista, that you push through your IH, symptoms, and you are really as inspirational to over 20,000 followers that you have. So we're very glad and honored to have you today. And we also have Alicia from Alicia's Journey with IH, who is also live streaming through her social media platforms. So we just really are welcoming anyone, whether you're a provider, a patient, a family member, or just anyone who wants to learn more about IH, to please feel free to speak openly, tell us about your journey, tell us anything you think, and we'll go from there.
And just a point of order, only if you're comfortable, feel free to turn on your video so it can be very interactive, but don't feel any pressure to do so. And also, again, no pressure, but if you are comfortable changing your name on Zoom from, say, phone or computer to either your first name or last name, so we kind of know who you are and can address you and ask you some questions, that would be wonderful also. All right, thanks. I think, Ashley, you just had a quick, right before we started, you were asking a question and then we invited everyone in. So maybe you can ask that question again.
Okay, sure. No problem. Well, first of all, I wanted to thank you all for creating the IIH Hub, because at the time when I was diagnosed about 3 years ago, I really couldn't find a lot of resources about IIH online. So it was more so wanting to say thank you for creating it and kind of giving a resource to a lot of people, because I think when you are first diagnosed and you really don't know what to think, your mind can draw a lot of conclusions, but having a resource like this and finding people that are also going through this is a really wonderful thing to have.
Well, thank you.
And also thank you for inviting me as well.
Absolutely. Well, we would love, because you have an amazing website. If you could just maybe tell us from the very beginning, from what you can remember, just your signs, symptoms, your journey, your personal opinion, your take, anything like that. Even, maybe what specialists you first saw or how many specialists you did see up to the point of diagnosis. Just a bit about your journey.
Sure, absolutely. So for me, my journey is a little interesting. It was first told to me that I had some nerve swelling behind my eyes, probably as early as maybe over 10 years ago. But at the time, I had no symptoms whatsoever, and it really wasn't explained to me in a way that I could understand. So I never really took the time to really learn more about IIH, and I really didn't understand what the optometrist was trying to explain to me at the time. So really, I would say it started back then, but I really didn't get a good grasp of what was going on until about 3 years ago. 3 years ago, I went to an optometrist for just my regular routine eye exam, and he told me he saw swelling behind my eyes, and he asked me about my symptoms. And of course, at that time, the main symptom he asked me about was, did I have migraines? Did I have any headaches? Anything like that? And I am one of the I don't know if it's rare, but I'm one of the rare people who I don't have headaches. So when he first told me the symptoms, I was like, I don't relate to any of that. But then he asked me what had I started feeling lately. And I said, well, I'd had a lot of neck tension and lower back pain. And so he was like, I really, really think that you should probably go and learn a little bit more about this. And he referred me to an ophthalmologist who, of course, I decided to go to within a couple of weeks. And that's where they saw the swelling. And he told me I had papilledema most likely. And he then referred me to a neurologist in this area to have a lumbar puncture. I had the lumbar puncture probably about 1 to 2 months after that initial optometrist appointment. And during the lumbar puncture, I believe the measurement was about 40, when I do believe it's supposed to be 25. If that's correct, you all could definitely let me know. But it was about 40, which of course told him that I did have IIH, and that of course I was already diagnosed with papilledema. So from there, I would say my journey has been a little bit straightforward. I was automatically put on Topamax, which my body didn't really agree with. So I then was put on Diamox, and I've been on Diamox ever since. And that has really made everything a lot better. I don't have as many of those symptoms. I do experience fatigue, but I don't have as many of the symptoms as I used to have.
Thank you for sharing. So right now, you would say you see a practitioner or provider for IH how often?
So now it went from seeing somebody about once a quarter to I see someone now basically once a year. It really depends on my symptoms. I have a really, really great neurologist. So I really go to her. If something pops up, I'll go to her. But right now it's basically once a year.
That's actually really great. I'm so happy to hear you have a great relationship with your neurologist.
Yeah, thank you. I'm really, really grateful. I will say this has been an interesting journey. I've often wondered if sharing my journey is helpful to people, because I know it's been a very straightforward journey, but I'm realizing more now that everybody's story is important. So I'm still trying to share it, even if it's been a little bit easier for me.
Well, we appreciate it. And like you said, every story is impactful. And I think it brings people to come forward and say their journey. I even met somebody who is in remission, technically, not on medications, no symptoms. So it's really great to hear from anyone and everyone, because this is by definition a rare disorder. But as we talk to more people, we're finding it's actually not so rare. So it's nice to hear your story, and you to put yourself out there and even create a website for it is just fabulous.
May I ask a question?
Mm-hmm.
So you just said you have a neurologist. That is great, and I'm very curious how you would define a great doctor. Edith said a good relationship with the doctor. I'm wondering how important that is, if it's about technical skill. Just very curious what you mean, because you always see these ads, the best doctor. And I'm wondering, from a patient's perspective, an IIH patient's perspective, what do you consider a good doctor?
So for me, I definitely would say a good doctor is someone who takes the time to listen to me and understand my story. I think that with IIH, one of the first things I think that was thrown out there for me was, oh, just lose weight and you'll be fine. And I know that not even with IIH, that is the common thing for going to doctors for a lot of different things, especially if you're an overweight person. They will throw out, oh, well, you should just lose weight. And the thing about my neurologist that I loved was that she really took the time to understand what my lifestyle was. She was great to talk to. Like, I think one of the things about me, I love to laugh. So if I can go into your office and we can laugh together, that tells me a lot about who you are, just like in general. And I can go in there and we can laugh together. But more than anything, she takes the time to understand my lifestyle. She actually remembers me when I come back to her office, and she's like, okay, so what you doing with your social media and all this sort of stuff. But also, she really takes the time to understand if I do have a flare up, we talk about it in depth. We talk about what I can do differently lifestyle wise. And more than anything, she just doesn't pressure me to do things that I don't necessarily want to do. And I think that's the biggest thing. She makes sure that I'm well cared for, but that I'm also comfortable as she's giving me information that could be helpful.
I love that. I love that, like you said, you can laugh with your providers. It makes them a real person.
Right, exactly.
If I have I think you were lucky first to find a very compassionate physician, and in a way you were lucky also to have typical symptoms of IIH, which is the swelling of the optic nerve, because no one could miss it. And where we see medical errands, we see patients whose symptoms are much less defined, or patients with chronic headaches, patient with pulsatile tinnitus, patient with dizziness, with chronic fatigue. And those patients are much more difficult to, those patients are much more difficult to diagnose.
It's actually really important that you said that, because as I was looking at a lot of people's stories online when I was first diagnosed, I saw many people who went through so many things trying to find the diagnosis, and it was scary, because I was like, well, why was mine straightforward and then everybody else, some people had to jump through hoops to find a diagnosis. So in a lot of ways I'm grateful, but I hate that, you know, so many people have had to have that experience.
Sue has raised her hand, so you want to unmute and jump in?
Yeah, I just wanted to share that I'm one of those patients who did have a great deal of difficulty establishing my diagnosis. And what I think is kind of interesting with it is that I'm also a family nurse practitioner. So in the whole process of it, I was able to do a lot of my own research. And for what I usually say is I kind of bulldozed my way into my diagnosis. So when I got my MRI back, I read it myself. I looked at all the images and I said, hey, what's going on here? Let's look at this a little further. Why aren't we doing the LP? Why are you ignoring me? Because my first neurologist was not a good neurologist. He literally ignored me for 2 months. And I needed my ophthalmologist to essentially stronghold him into getting the lumbar puncture. And you know, what's kind of sad about it is he's just kind of like that anyway. But then I had a elevated opening pressure of 30. He didn't treat me. I needed to seek out treatment as well too. I was finally put on Diamox, and then I saw a neuro-ophthalmologist. And by the time I saw the neuro-ophthalmologist, my RNFL was low enough, but my optic nerves were still abnormal, that she was actually questioning whether or not I had papillitis versus papilledema. So she didn't believe that I had IIH either, though I stayed on the Diamox and I developed pretty significant side effects on that medication, to the point where I even had GI issues that caused fecal problems like incontinence and everything too. My neurologist, that was poor to begin with, when I gave him a list of all of my side effects with the Diamox, looked at me and he said, what am I supposed to do with this? It was extremely frustrating, and I obviously left in absolute tears because I'm just giving him my side effect profile of the drug. I was eventually put on Topamax, which caused severe cognitive problems, excessive syncope. I literally lost consciousness for 20 minutes at one point. I was still told that's not IIH related. My neuro-optho continued to refuse to refer me to neurointerventional radiology and neurosurgery. And all I said to her is, I just want a consult. And she said, well, you don't have true papilledema. I don't think you have IIH. So I self-referred to Mayo Clinic, and it took about 2 months to get into Mayo Clinic. And the doctor I saw there was fantastic. I was off the Topamax at that particular time because, again, I didn't have IIH, they told me. And I had papilledema. I had elevated OP. I had severe venous sinus stenosis that included the sagittal area as well. I had all the rad signs. I was textbook essentially, except when I was treated, that papilledema was barely visible. I did have a stent placed on June 7th. So I'm just over 90 days, and the pulsatile tinnitus is completely resolved. None of the other symptoms have resolved. I'm off medication. I go in next week for my follow-up evaluation. I had 2 CTs over the summer because, again, I was fainting and I was having severe pain at the base of my skull, and my cerebellar tonsils actually decreased, or they herniated post-stent placement. So my brain kind of like dropped down about 4 millimeters, though I still have a little bit of CSF movement in there, but now I'm seeing a Chiari specialist next week as well too, to see what's going on there. So, you know, when you talk about having a good neurologist, it is so, so important. And then having a good neuro-optho who's not going to throw that weight piece at you, because I've lost weight. And as I lose weight, my symptoms worsen, which is extremely frustrating to me. I've been off work because I can't function. I can't function around my house. I have a farm. I can't farm. My life is completely changed. I applied for disability, and I've had doctors say to me, well, you're just giving up. And I'm like, I'm doing everything. I'm reading everything. I'm doing everything. I'm losing the weight. I'm doing everything that I possibly can. And it's just so incredibly frustrating. I did finally find a neurologist who treats my hemiplegic migraine, who's absolutely fantastic. And my hemiplegic migraines are finally controlled. But I still have numbness, tingling, paresthesias, hand cramping, loss of hand grip, that everybody says they don't know what's causing any of that. I was diagnosed with like cognitive issues, impaired processing speed, ADHD type symptoms. And 2 days ago was finally given a prescription for Concerta. And I'm on, like, today's my 2nd day. And that's really, really helping me finally focus, because I decided I love to do stuff and go to school. So I decided to do a holistic wellness certification program since I can't do anything else. I would have to rewatch my videos 3 times just to get the information, and the information goes in and it stays after I do that. But I am not the same person that I was before IIH, and it was sudden. It just, like, my bucket tipped over in November, spilled, and I can't get it all together yet. It's awful, absolutely awful. So, I mean, I'm just really appreciative for the doctors who are out there and are really caring and are dedicating their lives to trying to help us.
Sue, thank you so much. I'm so glad I connected with you and that you came on today to share your story. We definitely would love to hear more about how you're feeling now that this stent is placed. And, you know, and there are a few questions on the chat that I don't want to ignore. Marie has her hand up, and I believe they might be geared towards Sue's story. So if you'd like to unmute and maybe ask away,
Well, actually, I just
whatever.
put that there, but I had sort of more a general question, if it's okay. Like, so
Of
I
course.
lost 130 pounds. I'm a failure to thrive 47-year-old adult with long COVID, cancer, and IIH. My IIH or IH is different post-COVID, and I just wasn't certain how connected folks were to the influx of incredible research coming out, because all of a sudden other people are actually having our rare condition, lots of other people, and what collaboration is going on with the long COVID community, because a lot of folks there, they've got intracranial hypertension, the spinal taps aren't being ordered, the Recover study by the NIH stated that there were no visual disturbances. Of course, we know well there are visual disturbances. But I'm a person without the papilledema, and I first had my elevated spinal tap at 20. But I've wondered for 15 years if it was ME/CFS in addition, and I just can't, and like I can't find the right doctor for that. So I just keep on like testing with my doctor, and my doctor actually will not talk to me about anything related to my post-COVID life, which is kind of strange. But when you lose 130 pounds, you would think if that theory were accurate, that it would work, that it would be. So my conclusion is that my neural condition is now impacted by my long COVID. So, and that was that it's sort of a different spectrum of illness now, because that's what COVID does, is it reactivates or reignites. And I didn't know if research was being done already on the impact of COVID on current like IIH folks, and if suddenly weight loss is harder. I don't know if anyone else struggles with the fact that we have a rare disease, and these doctors seem to think that they actually know what they're talking about. And I don't mean that in like a dismissive way, but it's just a humbling thing. Like, we've got a lifetime of experience. We're far more experts in our lived experience, but it's really frustrating for me. And I didn't know what people say when I have like 4 rare diseases. So I'm used to explaining, but doctors aren't always happy. So I didn't know if people are encountering that too.
Yes, so I believe Pierre answered a question saying if there's significant stenosis on the venous sinus, the MRV would see it. And then kind of to circle back to a point that Ashley made is maybe since you love your neurologist so much, you could share with us maybe that person's information, because I do agree that there are some providers that are not comfortable or don't even know or are not up to date with information like how COVID has impacted all of these diseases and rare diseases, and maybe connecting people with providers who are comfortable, especially nowadays with telemedicine. We can help get you maybe a provider that is more comfortable with your disease process.
Yeah, and I know, well, I'm in Greensboro, so I know for me, I go to Greensboro Neurology, and the doctor is Dr. Yan, and she also has a wonderful nurse. I interact with her nurse more than anyone, and we've built a great relationship as well, but it's Greensboro Neurology.
Thank you so much. And I will add that onto our notes if anyone needs to get that information in detail. And Alexandra, thank you for joining us. You also have an amazing neuro-ophthalmologist, Dr. Beaufard in Boston. Thank you so much. We will add that person. And we would love for you to share your story too. I found you on Instagram, and thank you for coming on today.
Thank you guys so much. It's amazing to be here and hear your stories. I'm a little bit in tears hearing this because I was diagnosed almost 2 years now, and I'd never ever heard of this condition until going in to just be tested for my hearing. I had been suffering from pulsatile tinnitus, which I also had no idea about. I wasn't really sure what was going on with my hearing. I had thought it was related to possible blood pressure issues, which run in my family. So I had went in, I had my hearing tested, and I unfortunately have luck with not so great doctors. And the doctor that I had seen, and I explained that I had this whooshing in my ears, and her first response was, "This sounds like a brain aneurysm." And hearing that, I was so taken aback that I couldn't think of anything else except the fact that I might have a brain aneurysm, and had to wait 2 weeks for an MRI. Once I received the MRI, I was matched with the neurologist who then told me about IIH, and her first reply to me was, "This is happening because you're overweight. You're overweight and you need to lose weight and all of this will go away." And I've been overweight majority of my life, so hearing this was a complete shock to me, and I was upset. I was in tears and upset, and I didn't really know what to do from there except for, attempt to lose weight. And then to hear that this is a kind of exercise resistant condition was also very frustrating, because I work with an amazing life coach and personal trainer, and Coach B, who thankfully, before being diagnosed, I was on a great exercise regimen, and I was having, my vision was going, I was having the pulsatile tinnitus, and he was able to kind of work me down from that, and notice that something was going on. And this was also kind of part of, I just couldn't put all of the things together to think that that all of these things together meant something was wrong. This was also kind of after COVID. She would not bring me in for physical appointments. She felt that virtual appointments were enough. I was put on Diamox, which I did not handle well. Her response was to continue to up the Diamox and continue to lose weight. Those things were not helping me. I saw an ophthalmologist who gave me a visual exam, didn't mention anything about eye swelling. He said, "Yeah, your eyes look a little bit swollen," didn't mention papilledema, didn't mention anything else. My neurologist kept doing virtual visits and said, "Okay, keep losing weight, we'll keep upping the medication, and we'll go from there." I had an issue where I was getting, I don't know if anyone had this with Diamox, it causes a lot of tingling, hands, face, and feet. It happened one day on only one side of my face, which was terrifying. My neurologist said I needed to go to the ER immediately. They told me, well, I don't really know what to do. They gave me a lumbar puncture, sent me on my way. She switched me then to Topamax. Did not let me know any of the side effects or anything else. As I believe it was Sue was saying, I had severe cognitive decline, which was incredibly scary. They told me, no, it's not the IIH. That's not going to do that to you. My neurologist then had family issues. She went on a leave. I lost my job due to my cognitive decline and everything going on with my health, and then lost my insurance. During all of this, I lost peripheral vision, which I didn't know until later. I lost peripheral vision in my left eye. I then, once I got insurance back, I found this amazing, amazing Dr. Buffard. Once he realized my condition, and he saw that I was seeing him, he cleared his schedule and took 3 hours of his time to thoroughly examine me, make sure he knew what was going on. He sees me regularly, monthly, to make sure that my vision does not decline any further. I have since lost over 40 pounds since being diagnosed. So as we were saying, we know that this isn't just your weight and just losing weight. I also have, what Sue was saying, as I've lost weight, I also noticed that my symptoms do increase. I still have constant pulsatile tinnitus daily. I still have cognitive issues. I suffer from fatigue, incontinence. I actually just this morning had a CT to see if there are possible venous sinus stenosis issues. There's still a lot that I don't know about this condition. I'm still learning. I'm so grateful that you guys found me and I'm able to learn more from all of you. It's very scary. I'm also, my life has also completely changed. I'm also no longer working. There's a lot of things that I'm unable to do with my life now, and I'm learning to adjust to that. I'm so incredibly grateful to my new care team that takes the time to listen to me and help guide me through what's going on with me, because I was so confused and I had no idea what was going on. And everyone tells me, oh, you look great. You look amazing. And I do. I look great on the outside. I look wonderful. This is the smallest I've been in years. I feel awful most days. And all I can tell people is that to advocate for yourselves. Advocate. Don't let your doctors tell you, you know, oh yeah, just keep up, you know, we'll check in with you. We'll check in with you. If something doesn't feel right, keep pushing. Tell them that something is wrong. Tell them that this is not right. They don't know everything. I went to the ER one night because my headache was so severe and it just wouldn't stop. And I told them about my condition, and it was almost very too clear to me. The doctor went in back, Googled what my condition was, because he came back out and said, you know that for this condition, it's medication and weight loss, right? And I was like, I do know that, sir. Thank you very much. I do know that. I'm very well aware. I don't, you know, I don't desire lumbar punctures. My opening pressure when being diagnosed was 49. It's terrifying. I never know how I'm going to feel on a daily basis. And the only thing I can do is continue to advocate for myself. I keep up with my appointments monthly. I see my doctor. He tells me, go to the front desk, and if they tell you that there's no appointment, you tell them to book you on my lunch, and you make sure you come in. And I just have to keep going. I'm on a high dosage right now. I'm suffering from severe papilledema at the moment. The goal is to make sure that I do not lose any more of my vision. Thankfully, I'm at a point, because I am still losing weight and things aren't getting worse, but they're not getting better, that I don't need a shunt yet. But I do still have quite severe papilledema. I cannot see here the side. But I've changed my diet, which has seemed to have helped in some aspects. I unfortunately cut out caffeine. There's a lot of things that I've noticed, you know, that do aid me, but at the same time, the symptoms are there daily. And I can only speak for myself, as Ashley was saying, it's very different for everyone. It's very, very different for everyone. I know some people, I do get the headaches. I don't get them as severely as I used to. For me, I noticed something that I didn't realize what was going on with me, is that I had severe eye pain almost every morning and nausea. And I had no idea what was wrong with me. I'm like, I must have allergies or something must be bothering me. And this is what it was.
Alexandra and Ashley, if I can ask you both a question. First of all, thank you for sharing. It's just so intense to hear. I mean, not just you, but also Sue and everyone, like, and Ashley, like, just hearing what you're going through, and it's at least some relief that you have found a care team that is actually a care team. But I want to ask you both about this advocating for yourself, and if that came naturally to you at first, or did you have to kind of learn some tricks, and if you can share some tricks on on how you've done that.
Well, I know for me, I just feel like I've always been the type of person that if I'm not satisfied with something, that I have to say something, because I feel like this is the only life I have. And I'm like, I deserve to get the best care that I can. So I feel like being an advocate for myself, is something I had to be. I think that when I first started meeting with people about this, I was kind of just taking in all of the information. But after a while, I started to ask tons of questions because I needed to fully understand. And I also realized very early on, like some of us, that the people I was seeing did not have all of the answers, and there was going to have to be some advocacy on my own that I was going to have to do. And I know we can talk about it later, but one thing that Alexandra said that I really started doing for myself, that I've mentioned on my blog, is that I changed the way that I eat. I find that changing the way I eat has made me feel a lot better than a lot of other things. That, in addition to the Diamox, has helped me a lot. But I'll let Alexandra talk too.
I agree. There was a lot that I didn't know. And at first, you have to take everything in and understand what's going on, because there's a lot you don't know. I had no idea what this condition was when they first told me about it. I was like, I had to look it up, because I'm like, I have no idea what you're talking about. And to hear how rare it was and things like that, I was mind blown. And then, when you continuously hear, well, lose weight, lose weight, lose weight, lose weight and it'll go away. And I'm like, there's no way that me just being overweight caused this, because I've been overweight. I've been overweight, and this didn't just happen overnight. Like, there's no way that this just happened. And you can't tell me to just go home and lose 50 pounds and come back and I'm going to be perfectly fine. There's no way that's solvable. And I realized that the care team wasn't really, they were just more focused on, well, you need to be healthy and this is all going to go away. I was like, you're not really I don't think you not necessarily care, but I don't even have the words what I'm looking for, but I feel like weight is a big factor in a lot of things when it comes to healthcare. It's kind of focused like, well, you're overweight, so you're not healthy, and this is going to fix a lot of things.
Yeah, Alex, your two stories, Ashley's and Alexandra, are very, very different, because Ashley is well controlled with a small dose of Diamox that she tolerates well. While you, Alexandra, are not well controlled at all with medical treatment, and you don't tolerate the Diamox. And I mean, I think you are a candidate for more than medical treatment, for one of a surgical treatment. And we have shunt and we have stent. So today we have with us Brian Snelling, who is a neurosurgeon, who is trained in doing both. So maybe he could, Brian, do you want to answer Alexandra?
Yeah, just a quick background. I think I really appreciate everybody sharing their stories. It's always refreshing and inspiring to hear how you guys have come forward and shared really personal. I can tell you from the other side of the other side of the clinic room or whatnot. It breaks my heart to hear a lot of what you guys have gone through. I'm sure, as Pierre knows, when you do know about IIH, or let me rephrase that, like when you know as much as we know currently, which there's still more to be learned, and you see patients who have sort of bounced around from physician to physician, and they haven't really received a diagnosis. It sort of breaks your heart that people have gone sort of untreated. So I certainly understand that. And one thing that I always tell people, and this is why I think it's so much, you guys mentioned it's so important to be an advocate for yourself, that in medicine, a lot of times physicians are very siloed in terms of not only what they know, but also what they do. So if you go to see your primary care doctor, they're probably not going to know about IIH, right? It's just not something that they're going to understand. Certainly if they're older, and they've gotten out of med school, that's just not something that they may understand. And even, a neurologist, that may not be something that that may be something that they have some sort of cursory understanding of, but what are the latest treatments? You know, do you need to see a neuro-ophthalmologist? What do you need some sort of surgery? When do you say, okay, you're not tolerating Diamox? Those can all be difficult, you know. So I think being your own advocate is unfortunately what often has to take place. Otherwise, you find yourself going from physician to physician until you end up seeing somebody who says, okay, well, I actually do know what's going on with you, and you have IIH and you need X, Y, and Z. You're going to have to get, you know, lumbar puncture, this, and this, right? And then somebody finally tells you that sort of can get you started on the right path. Surgery wise, you know, it sounds like there may be someone on the call who's had a shunt before, but a shunt is just, it's sort of what we neurosurgeons call a last resort for IIH. The problem, you know, usually all shunting is just plumbing. It's plumbing that drains the brain and spinal fluid in a small tube that goes under the skin down to the belly. And it's been around since the 50s, and it's just some simple tubing and a little valve that you can change with a magnet. There's a lot of other illnesses and diseases that can result in overproduction of this brain and spinal fluid. That's called hydrocephalus. And that's usually what neurosurgeons place them for, is that your body makes about a soda can's worth of brain and spinal fluid every day, and you reabsorb it. You've been doing it your whole life and you never know it. But when you make too much of this fluid and you don't reabsorb it fast enough, that fluid builds up, and then a shunt is a great way to fix that. So for a lot of people, it's a really great treatment. How that relates to IIH, though, is that as a last resort, one of the ways to reduce the pressure in the brain or in and around the brain is to remove this fluid. It's just one of the ways to do that. And it sort of does what Diamox is doing. Diamox helps you produce less of that fluid. Remember, you're making a soda can's worth every day and it's getting reabsorbed. So it helps you produce less of that fluid. But how the shunting works is the shunting just takes that fluid, takes it out of the skull, puts it around the belly. So it's not really solving what's caught the issue. And so I think that's where some people, that's why neurosurgeons like to treat that as a last resort, because it's an overproduction of brain and spinal fluid isn't the problem. And that's usually what we place them for. It can help. And how it helps is it usually can help prevent worsening of vision. So if someone were to come to see me in clinic and they had vision problems and they weren't candidates for any other sort of treatment and they'd failed medical therapy, shunting sort of is the last line of defense we have to save vision. And it can work for that. The problem is it doesn't solve all of the other problems that go along with IIH. It wouldn't solve pulsatile tinnitus. It wouldn't solve headaches, right? It really just manages to keep your vision hopefully where it's at, not let it get worse, but it may not even improve the visual loss you may have already had. The other, you know, again, and if you've not seen a neurosurgeon before, we're often reluctant to place them. Oftentimes, when you're placing this tubing into the brain, the fluid spaces are pretty large, and they're easy to place, and the catheter can drain the fluid adequately. What happens in IIH, though, is that as that pressure increases in the brain, due to venous, an inability of the venous blood to return properly and whatnot, the fluid spaces actually get really small, and they develop sometimes what you can call slit-like ventricles. If you've had MRIs and you have IIH, you may have seen that on your MRI report. Oh, it says you have slit-like ventricles. What that means is now we have to place this tubing into a very tight space where the actual volume of fluid is very narrow. And all this tubing is it's simple plumbing. It's like the plumbing in your house, right? So it's in this patient cohort, in IIH patients, that tubing can break down quite frequently. In my experience, I've seen patients that have had shunt malfunctions where the brain collapses around the catheter because we're trying to do the best we can with what we have, and they need a revision surgery. So that can often be you get put on the path of getting multiple revision surgeries. Sometimes they work well, but sometimes it can be frustrating. So that's why we generally like to reserve that as a last resort. There are other options. There's things called optic nerve sheath fenestration, which is done by usually like a neuro-ophthalmologist. And as Pierre alluded to, there's venous sinus stenting, and that's something that's we're learning more and more about. That's taken more of a role in helping patients And the thought is that by that, it's hard to know. I think Pierre, correct me if I'm wrong. Pierre's very humble. Pierre's a world expert in all of this. But it's hard to know whether the vein narrowing comes first or the vein narrowing is just a sequelae of IIH itself. But by opening the vein back up with a stent, you can dramatically reduce that pressure. So what will often happen is if you're determined to, you have venous sinus stenosis, you're determined to be possibly a candidate, the first thing you would have done is what's called venous sinus manometry. And a venous sinus manometry generally is it's where you have an outpatient procedure where they put a small catheter up, and sometimes they put the catheter in one of the arteries that delivers blood to the brain, and they take some pictures of the arteries, and the arteries drain into veins so they can look at the veins. But separately, they'll take a very small catheter and put it in the venous system and go up, and they'll actually measure the pressure around the different veins of the brain. The veins of the brain are called sinuses. That's very confusing, right? Because you're like, well, wait, isn't my sinus like what drains? Like it's my nose or something like that, but it's not. So sinus is a medical term that can mean two different things. It can either mean the sinuses in your nasal passages, but when you talk to physicians like Pierre and myself, that really becomes the sinuses is a medical term for the veins that drain the large veins that drain the blood from the brain back into the internal jugular veins of the neck. And so if that narrowing is there, we take a very small catheter and we navigate past the narrowing and we measure the pressure. And we say, okay, is the pressure high anywhere? Is it normal anywhere? And usually what we often find is that in patients with IIH that have had some sort of imaging like an MR venogram, veno meaning looks at the veins, or a CT venogram that looks at the veins, and they have that narrowing, we see what's called a gradient. A gradient just means on the side furthest, towards the top of the head, furthest away, that pressure can be high. And on the other side of the narrowing, that pressure comes back towards normal. So we know that narrowing is restricting the flow of blood back to the heart. And those patients, we know that if that gradient meets a certain criteria, it's in a certain location, that they probably benefit from having a stent to open up that narrowing and normalize that pressure. So when you normalize the pressure in the veins, you've normalized the pressure in the rest of the head, and you can hopefully avoid having to have a shunt surgery or have some other procedure. But that's generally how that works. And like I said, if you think of those three sort of procedures as a bucket, meaning the optic nerve sheath fenestration, the shunting, and venous sinus stenting, that's sort of a bucket of what we would say are procedures or surgeries that are offered to patients that we say fail medical therapy. And so as we've had a lot of different inspiring stories that some patients do tolerate these medications, but a lot of times people don't. I mean, Diamox is old medication, and the doses sometimes that it requires to be effective can cause a lot of side effects that patients just quite frankly can't tolerate. So I don't know, Pierre, do you have anything to add?
Yes, I mean, actually, none of these treatment, medical or surgical, has any FDA approval. Diamox is approved for glaucoma, but is not approved for IIH. Same thing for the Topamax. It's approved for headaches, but not specifically for IIH. And neither shunt, nor optic nerve sheath fenestration, nor venous sinus stenting. There is no large studies. None of these three techniques have had any have been validated by a large what we call RCT, randomized controlled trial, a large prospective trial. However, we are physicians, we do them, and we know that they do work, so we use it off-label. It means that they are not FDA approved for this indication, but we will use it nevertheless. No, it's certainly time to do a study on that, but that will be for the future. It certainly doesn't concern us immediately.
Yeah.
I just want to, earlier, Marie said, is there a place where there's a list of all? Is there like a list of social media accounts with people that are on different IIH journeys? And I don't know, I don't think we've put one together yet. Maybe Ashley, you have, but we should work on that. And because Marie followed that up with, may as well leverage our power and voices. And I think that actually ties to what Pierre just said, Dr. Gobin just said. You know, if everyone together raises their voices, maybe that can make, you know, some of these studies happen and make more of this push forward together, not just within, you know, when you're in the room with your own doctor trying to convince them, but, you know, just getting people, doctors in general, to pay attention. And bandy together. I think it's a really good idea. So Marie, good call on that one.
I may run digital campaigns.
Say that again?
I may have run digital campaigns.
Okay. All right. Well,
So,
yes.
I don't know what you mean by.
oh,
Hey Siri,
sorry.
I may have run digital campaigns.
I'm so sorry.
Edith, do you have more questions for Ashley? I'm aware that we're starting to run up against our hour, and so I just want to and by the way, there are also other questions that people have asked in the chat, and we clearly have not gotten to all of them, but we will do our best to answer you over email or on the hub itself. But Edith, do you want to jump back in?
Yes, thank you. First of all, I cannot believe how fast this hour went. That's number one. Number two, I think this is the beginning of many more chat sessions, some, you know, more community advocacy. One of the plans that we had for our website is to create a provider page. So we do appreciate a handful of names that were placed on the chat and put it out there on our website. And if there are people who are searching for a neuro-ophthalmologist or a neurologist that someone can maybe vouch for or say, hey, I had a great experience, or yes, they do have some familiarity with IIH, we want to have that available for you guys. And for anyone who a family member may want, you know, to help you out and make those phone calls, because it is taxing. I know Alexandra mentioned you lost your insurance, and I know Alicia did too. And that really sets people back, you know, just to get a simple MRI to tell a lot of information to a provider. So, you know, we're here for you. We're trying to connect people with providers and other patients. And, you know, this isn't the end all be all. This is just the beginning. And we're very grateful for everyone who's, you know, spent the hour with us today. And we hope we can connect and maybe even have another chat at the end of the month. Our plans are actually, we connected with Dr. Raj Kamal Kungara, who is in California. He is a neurointerventionalist, and he is going to be starting up a study enrolling patients who have suspected IIH and brain fog, because they're trying to figure out exactly what this brain fog is. There's no true definition, there's no true criteria, and he's very interested and is pushing for patient advocacy and IIH. So we are hoping to have him next month for our webinar in October to connect you guys to him. Anyone who's interested in enrolling in that trial, we'd be very interested to see.
Also, I just want to, a couple things came up in the chat, like Marie brought up the glymphatic system, and I pointed to a lecture that we had done a couple weeks ago, just like this, specifically on that. Alexandra brought up the question of weight and the medical system in general. We had someone on I think a month or two ago, just on that very topic. So this is as Edith said, this is probably hopefully the first of many very groupy kind of chats, but we also have a lot of more lectures on specific topics. So please feel free to go to the hub, go to this IIH webinar area, and you can find some topics that's like detailed information. There's a neuroradiologist that speaks. There's a lot of really good stuff. And also just one quick thought on advocacy for what it's worth. Doctors sometimes tend to listen to other doctors more so than patients. So maybe there's a physician section on IIH Hub. So maybe next time you go in, stick that in their face and say, check this out. There are lots of doctors talking about this. Please read. So anyway.
Great idea.
Yeah.
Yes, and we apologize if we haven't gotten to every single comment or question on the chat. We'll try to circle back on that. And the last question I do see on here about the trial, I will, I can email everyone who is on the session today with that doctor's information and the universities associated with for that research trial that's going on. But thank you, everyone. Thank you, Dr. Gobin. Thank you, Dr. Snelling. Thank you, Ashley, Alexandra, Sue, Marie, everyone. We are so grateful. Barack for coming on today. We're here for you guys. So, you know, please reach out to us anytime. We are pretty quick to respond. And we'll hopefully plan another chat session in a couple of weeks, or at least by the end of this month, because this is a special month.
Thank you.
Thank you.
Bye-bye.